Stool stuck in the rectum. What is it and what to do? The profound discomfort and persistent frustration of feeling the undeniable urge to defecate, yet remaining completely unable to pass anything, despite prolonged effort in the bathroom for often 30, perhaps even 60 minutes or more, is an experience far beyond typical transient constipation. The internal pressure and tangible sensation of a blockage, coupled with the body's refusal to respond to desperate attempts, inevitably leads to an overwhelming sense of defeat, prompting one to walk away disheartened, promising to try again later, only for the same agonizing cycle to repeat, underscoring a far more serious underlying issue than a simple home remedy could ever address. I am Dr. Michael Addy Yemi, and today I aim to thoroughly unravel the true meaning of stool becoming physically entrapped within the rectum, elucidate precisely why this condition, medically termed fecal impaction, carries significantly greater risks, particularly as we age beyond 60, and meticulously outline the step-by-step actions you must take, grounded in genuine anatomy and practical solutions, acknowledging that while this topic may inherently feel uncomfortable to discuss, your health and well-being must always take precedence. If any aspect of this experience resonates even slightly with your own, I urge you to acknowledge it by typing "yes" in the comments without hesitation. Recognizing that you are not isolated in this struggle not only fosters a sense of community, but also helps countless others who are silently enduring this debilitating condition to discover this vital information. To truly grasp the internal events, let me illustrate the physiological reality not with abstract medical diagrams, but with a relatable, real-life scenario that I hope will instantly clarify the gravity of the situation. Visualize a once majestic, free-flowing river, a source of steady current and nourishment for years, where water moved gracefully, providing everything necessary downstream. But now, picture this river gradually, almost imperceptibly, beginning to slow over weeks, perhaps due to an extended dry spell reducing its volume or the insidious accumulation of natural debris in a particularly narrow section. The river doesn't cease its flow abruptly, but rather decelerates progressively, becoming sluggish until, one day, the accumulated debris has compacted so densely at a critical bend that the water's passage is literally and completely blocked, transforming the river into a stagnant, impassable barrier. This vivid metaphor, unfortunately, represents the state of your colon, where the once efficient muscular tube designed to propel waste material towards the exit while simultaneously absorbing vital water has succumbed to a similar obstruction, a condition medically known as fecal impaction. However, I deliberately choose to translate this clinical term into simpler language because the detached professional nomenclature often leads individuals to gravely underestimate the profound seriousness and potential dangers associated with it. Under optimal, healthy physiological conditions, the large intestine, or colon, performs its duties beautifully, almost automatically, facilitating the smooth transit of waste, the precise absorption of water, and ensuring the stool maintains a soft, manageable consistency for comfortable elimination. Yet here is where the aging process introduces significant, often underappreciated, changes that fundamentally alter this delicate equilibrium. Reality, I implore every person over the age of 60 watching this presentation to deeply internalize. As our bodies naturally mature, a confluence of physiological shifts occurs within the intricate digestive system. The muscular contractions responsible for propelling waste through the colon, those essential rhythmic squeezes known as peristalsis, become noticeably slower and less vigorous. Concurrently, the neural signals that meticulously coordinate these vital contractions diminish in efficiency, leading to less synchronized and weaker bowel movements. Furthermore, the body's innate thirst sensation often decreases with age, a crucial factor that renders many older adults chronically, albeit mildly, dehydrated without their conscious awareness, depriving the colon of the essential fluid needed to maintain stool softness. Adding to this complex interplay are the widespread effects of commonly prescribed medications, including, but not limited to, blood pressure drugs, iron supplements, calcium channel blockers, and various pain medications, many of which, while vital for managing other health conditions, unfortunately list reduced bowel motility as a direct and significant side effect. When all these compounding factors, slowed peristalsis, inefficient nerve signals, subtle dehydration, and medication-induced deceleration converge, they create an almost perfect internal environment for waste material to traverse the colon far too slowly, lingering in the lower segments for extended durations, losing an excessive amount of moisture, and gradually transforming from a soft, pliable, and manageable substance into a hard, dry, and essentially immovable mass. By the time this retained waste has accumulated and sat unpassed for 5, 6, or even 7 days, it has undergone such severe dehydration and compaction that it can only be accurately described as a dense, solid, concrete-like mass. And precisely when this unyielding mass finally reaches your rectum, the terminal storage section located just before the point of exit, and its sheer size and rigidity prevent it from passing through, you have developed a severe fecal impaction, causing the intense, palpable pressure you experience, the profound exhaustion derived from fruitless straining, and the chilling, yet entirely justified fear that something is fundamentally and seriously wrong within your body. Now, let us dedicate substantial time to understanding why this condition is demonstrably more dangerous than most people initially perceive, as this is the aspect that frequently catches individuals completely unprepared. The terms constipation and fecal impaction are often mistakenly used interchangeably, leading people to dismiss the latter as a mere inconvenience. However, a true fecal impaction is neither trivial nor harmless, carrying a multitude of serious implications for the body's internal systems. Let me meticulously detail the cascade of events that unfolds inside your body when a substantial, hardened mass becomes lodged in your rectum for an extended period. The primary concern revolves around structural pressure. Your rectum, while possessing a degree of flexibility, is unequivocally not designed to indefinitely accommodate a cemented, severely dehydrated mass of this nature. When subjected to chronic overdistension by an impacted stool, the blood supply to the delicate tissue lining the walls of the rectum becomes dangerously compromised. The cells that constitute this vital lining are utterly dependent on a continuous and adequate supply of oxygen and essential nutrients delivered by the blood. When this critical circulation is either significantly reduced or entirely cut off, these cells enter a state of severe distress, struggling to survive. In instances of severe or prolonged impaction, this cellular distress can regrettably escalate to significant tissue injury, potentially requiring advanced medical intervention, such as surgical repair, to rectify the damage. Furthermore, an aspect that genuinely astonishes most patients when I elucidate it in the clinic involves the intimate anatomical relationship between your rectum and your urinary bladder, which are immediate neighbors, sharing an incredibly confined space within the pelvic cavity, separated only by a thin, fibrous wall. When your rectum is unnaturally packed with a solid, rigid fecal mass and stretched far beyond its normal physiological capacity, it physically exerts substantial pressure against the adjacent bladder. For women, due to the specific configurations of pelvic anatomy, this compressive pressure is often even more pronounced. Patients, in turn, experience a sudden, perplexing, and often painful difficulty urinating, characterized by a persistent feeling of constantly needing to void, yet only being able to pass a few painful drops, or, in the most severe cases, experiencing a complete inability to urinate at all. I have personally encountered numerous patients who presented to my clinic genuinely convinced they had developed an acute, overnight bladder infection, only for comprehensive diagnostic evaluation to reveal that the true underlying cause was a severe rectal impaction mechanically compressing the bladder from behind. Once the impaction was successfully addressed and resolved, the distressing urinary symptoms invariably disappeared completely. However, the complexities and potential for misdiagnosis do not end there. There is one more critical symptom that I must specifically warn you about, precisely because it profoundly confuses individuals, often leading them to make choices that dramatically worsen their condition. This phenomenon is known as overflow incontinence, and its superficial presentation strikingly resembles ordinary diarrhea. Allow me to elaborate on its mechanics. The rigid, solid fecal mass effectively blocks the primary exit route, creating an impenetrable dam. However, your intestines, located higher up in the digestive tract, continue their normal function of producing liquid waste. With the main exit obstructed, this liquid waste has nowhere to go except to seep around the outer edges of the hard, unyielding blockage, much like water finding a minuscule crack in a dam and leaking unpredictably. Upon observing this liquid discharge, individuals often mistakenly conclude, well, I clearly don't have a blockage, I am experiencing diarrhea. And tragically, some proceed to purchase and ingest anti-diarrheal medications, aiming to stop what they perceive as an inconvenient bout of loose stools. This, I must emphatically state, constitutes one of the most perilous mistakes one can make in this specific medical situation. Anti-diarrheal medications function by effectively shutting down the natural movement and muscular contractions of your intestinal walls. By taking them, you inadvertently paralyze the very mechanism that your body, in its desperate attempt, is utilizing to try and work around the problem, thereby cementing that impaction even more deeply into place and exacerbating the obstruction. I strongly urge you to save this video immediately, as you may not require its guidance today, but should this situation ever arise for you or a loved one, having this detailed, step-by-step guide readily accessible could genuinely be life-altering. If you are experiencing what appears to be diarrhea concurrently with days of feeling utterly unable to fully empty your bowels, please, for your own safety, critically consider the distinct possibility that it is overflow incontinence, not true diarrhea, and under no circumstances should you medicate it without first consulting with a medical professional. Turning our attention now to a critically important demographic, I want to address my older adult viewers directly, as the statistical realities regarding fecal impaction in this age group are sobering and regrettably under-discussed in mainstream health content. Fecal impaction is not a condition uniformly distributed across the general population. Rather, it disproportionately affects adults over the age of 65, with the risk escalating significantly with each successive decade of life thereafter. In settings such as nursing homes and long-term care facilities, some comprehensive studies indicate that fecal impaction can affect upwards of 40% of residents, solidifying its position as one of the single most common gastrointestinal emergencies encountered in geriatric medicine. Yet, despite its prevalence, it also stands as one of the most preventable conditions when individuals are adequately informed about the specific factors that elevate their risk in the first place. Let me delineate the major risk factors that are particularly pertinent to older adults. Reduced mobility emerges as an enormous contributing factor. When we engage in physical movement, whether it's walking, structured exercise, or even simply standing and performing light housework, we are not merely exercising our muscles, but also mechanically stimulating the intricate workings of our digestive system. The simple, rhythmic act of walking, for instance, generates gentle, consistent pressure within the abdomen that plays a crucial role in helping to keep intestinal contents moving smoothly. When mobility inevitably decreases due to conditions such as arthritis, the recovery phase following a recent surgery, the aftermath of a fall, or any other limiting health reason, that essential mechanical stimulation largely disappears, causing the colon's natural rhythm to slow down considerably. Dietary changes constitute another pivotal factor. Many older adults often experience a decrease in appetite, leading them to consume smaller meals, which frequently translates into a reduced intake of dietary fiber, a critical component for adding bulk to stool. Concurrently, they may also drink less water, partly because the innate thirst mechanism, which serves as our body's primary signal for dehydration, becomes less reliable and less potent with advancing age. All of these dietary and hydration alterations collectively diminish both the bulk and the moisture content of the stool, rendering it far more susceptible to hardening and impaction. Then, there is the undeniable influence of medications, a subject I strongly advocate every person over the age of 60 discusses in depth with their primary care physician or pharmacist. An alarming number of the most commonly prescribed drugs for older adults carry constipation as a direct and well-documented side effect. This extensive list includes opioid pain medications, various types of antidepressants, antihistamines, iron supplements, calcium supplements when taken in high doses, and diuretics, which promote fluid loss. If, like many of my older patients, you are managing multiple health conditions and consequently taking several medications simultaneously, the combined, synergistic, constipating effect can be profoundly significant. Finally, there is the often overlooked yet critical issue of suppression. Many older adults were raised in an era where discussions about personal bowel habits were considered deeply taboo and inappropriate. Consequently, they may experience the natural urge to defecate but choose to suppress it because they are not at home or it is perceived as an inconvenient time. Repeatedly suppressing that innate urge over months and even years gradually retrains the rectum, diminishing its sensitivity to the physiological signal for elimination. The urge becomes less frequent, less urgent, and waste material consequently sits within the colon and rectum for much longer durations, increasing the risk of dehydration and impaction. Understanding your own unique and specific risk factors is, therefore, the absolutely essential first step towards preventing this distressing situation from ever recurring. Before we delve into the precise, step-by-step solution, it is imperative that you ensure you are watching this information in an environment where you can concentrate fully and without distraction, because the detailed protocol I am about to present could genuinely help you avoid an emergency room visit. All right, with a comprehensive understanding of what is happening internally and why, let us now focus on the immediate, practical actions to take if you find yourself currently in the midst of this difficult situation, constituting an emergency action protocol. The very first and most crucial instruction I must impart, and I need you to absorb this clearly and unequivocally, is this: cease all straining immediately. I recognize that the impulse to push harder, to try different angles, to exert more force, feels entirely instinctive and that your body is screaming at you to do so. However, the physiological reality of a solid, dehydrated impaction is that it does not respond to pressure from above in the same way that normal, soft stool does. It is simply too rigid and unyielding. What additional aggressive straining actually accomplishes is a significant increase in the risk of causing painful conditions such as hemorrhoids, anal fissures, small tears in the anal canal lining, or even, in rare but serious instances, a Valsalva syncope, a sudden, dangerous drop in blood pressure triggered by excessive straining, which can lead to fainting. For older adults, particularly those with pre-existing cardiovascular conditions, aggressive straining can also impose a dangerously elevated strain on the heart, potentially leading to cardiac events. Therefore, stop straining, take a moment to breathe deeply and calmly and allow us to work through this challenging situation systematically. Step 1 involves the targeted use of glycerin suppositories. Proceed to any pharmacy, as no prescription is needed for this product, and purchase adult-strength glycerin suppositories. For a well-established, hardened impaction in an adult, a single suppository is often insufficient to achieve the desired effect. In accordance with clinical guidance, and often in consultation with a healthcare provider, many practitioners recommend using 2 to 3 adult-strength suppositories simultaneously for an established impaction to maximize their efficacy. Here is the precise method for their administration. Position yourself by lying comfortably on your left side, critically, not on your back, and certainly not sitting upright. This specific left side position is anatomically advantageous as it aligns with the natural curve of the sigmoid colon and rectum, thereby directing the medication most effectively towards the impacted mass. Before insertion, apply a generous quantity of water-based lubricant to each suppository. This is a step you absolutely must not omit. The surrounding rectal tissue is likely already irritated, inflamed, and highly sensitive due to the impaction, and proper lubrication ensures both greater comfort during insertion and significantly enhanced effectiveness of the suppository. Insert the suppositories gently yet deeply into the rectum. As you do so, breathe slowly and steadily, focusing on relaxation. Following insertion, and this is where many individuals inadvertently undermine the treatment's success, remain absolutely still and do not move. Stay lying on your left side, completely motionless, for a minimum duration of 30 to 45 minutes. Set a timer if necessary to ensure compliance. Glycerin suppositories work by 2 primary mechanisms. They draw moisture into the stool from the surrounding rectal tissue through the process of osmosis, and they simultaneously lubricate the rectal walls. This process requires adequate time to soften the hardened outer layer of the fecal mass before any movement can occur. If you rush to the toilet after merely 10 minutes, you will, in all likelihood, only expel the suppository itself, leaving the impaction stubbornly in place. Step 2, the second attempt, comes into play if, after the initial round of suppositories and the recommended waiting period, nothing significant has passed. It is crucial not to despair, and certainly not to immediately revert to straining. Rational and responsible medical decision to seek professional intervention. At a hospital, the clinical team possesses access to high-volume therapeutic enemas, which contain medicated solutions specifically designed to penetrate much more deeply into the colon than anything available over the counter. They also have sophisticated imaging capabilities, such as X-rays, to accurately assess the exact extent and location of the impaction, determining whether it is confined solely to the rectum or if it extends further into the sigmoid colon or other parts of the large intestine. In cases where even potent clinical enemas are insufficient to resolve the impaction, which, though less common, does occur, particularly with long-standing and extremely hardened fecal masses, a specialist will perform a procedure known as manual disimpaction. I want to be entirely straightforward and transparent with you about this procedure. It is precisely what its name implies. A physician, utilizing protective gloves and a substantial amount of lubrication, manually breaks up and carefully removes the impacted mass piece by piece from the rectum. Because the surrounding rectal tissue is typically extremely inflamed, swollen, and sensitive by this advanced stage, this procedure is commonly performed under sedation or regional anesthesia to ensure patient comfort and minimize distress. While it may undoubtedly sound uncomfortable to hear about, it is a safe, routinely performed clinical procedure, and the profound relief that patients invariably report immediately afterward is, without exception, extraordinary and life-changing. Once the impaction has been successfully cleared, whether through diligent at-home efforts or with essential medical assistance, your body embarks upon a crucial, albeit brief, recovery phase that demands your dedicated attention and care. For the initial 24 to 48 hours following clearance, the rectal tissue will predictably be irritated, swollen, and highly sensitized. You may experience some localized discomfort, light spotting of blood, or a persistent feeling of rawness in the area. These are expected and temporary symptoms that will gradually resolve with time and proper care. To provide significant relief and actively promote tissue healing, a warm sitz bath, immersing the lower portion of your body in warm water for 10 to 15 minutes, 2 to 3 times a day, is highly recommended. Your dietary approach for the first few days post-clearance should meticulously emphasize easily digestible, soft, and importantly, fiber-containing foods. Consider options such as warm oatmeal, well-cooked vegetables, ripe bananas, and broth-based soups with soft vegetables. Conversely, it is crucial to stringently avoid anything dry, tough, or inherently low in moisture, as these can irritate the healing tissue and potentially contribute to recurrence. Furthermore, commit to drinking water consistently and deliberately throughout the entire day, even if you do not actively feel thirsty, as rehydration is paramount. This immediate post-impaction period, while the memory of the distressing experience is still fresh and vivid, is also the opportune moment to proactively schedule some critical medical appointments. Book a follow-up visit with your primary care physician to thoroughly review your entire medication list, specifically scrutinizing it for any drugs known to cause constipating side effects and discussing potential alternatives or adjustments. If constipation has been a persistent and recurring pattern for you, it is highly advisable to request a referral to a gastroenterologist, a specialist who can conduct a more formal and comprehensive evaluation of your colonic motility and overall digestive function. And critically, if you have not undergone a colonoscopy within the currently recommended time frame for your age and risk factors, this is an exceptionally important moment to ensure that any potential structural causes, such as a narrowing of the colon, stricture, or an abnormal growth affecting the passage of stool, are properly evaluated and ruled out. To conclude our comprehensive discussion today, I want to impart the single most important piece of information I can possibly offer. Everything we have discussed up to this point, while critically necessary and potentially life-saving, has focused on crisis management. And crisis management, by its very nature, is never the ultimate goal. The overarching objective is to meticulously construct a lifestyle and implement preventative measures that ensure this debilitating crisis never arises again. Long-term prevention of fecal impaction in older adults is firmly founded upon 4 essential pillars. Pillar 1 is unwavering hydration. Water is, without exaggeration, the single most powerful and effective tool your colon possesses for maintaining the softness and pliability of waste material. Aim for a consistent intake of at least 6 to 8 glasses of water per day. If consuming plain water proves challenging or unappealing, warm herbal teas, nutritious broth-based soups, and a variety of water-rich fruits and vegetables, such as watermelon, oranges, and cucumbers, all contribute significantly to your daily fluid intake. Set regular alarms on your phone if necessary, and consciously integrate this into a deliberate, consistent habit. Pillar 2 is consistent movement. You are not required to embark on training for a marathon. Rather, a moderate 20 to 30-minute walk daily is genuinely one of the most profoundly impactful actions you can take for the sustained health of your digestive system. If walking presents difficulties due to physical limitations, Even gentle chair exercises, specific yoga poses, or swimming can effectively help maintain intestinal motility and stimulate bowel function. Pillar 3 is dietary consistency. Incorporating adequate amounts of soluble fiber found abundantly in foods like oats, various fruits, berries, apples, legumes, beans, lentils, and well-cooked vegetables adds essential bulk to the stool and crucially helps to retain moisture. If you are not currently accustomed to a high-fiber diet, introduce fiber gradually to prevent uncomfortable side effects such as excessive gas and bloating. Furthermore, establishing consistent meal routines, eating at approximately the same times each day, significantly assists your intestines in developing a predictable and healthy rhythm for digestion and elimination. Pillar 4 is the crucial practice of scheduled bathroom time. The gastrocolic reflex, which is the natural physiological signal your colon sends to prepare for a bowel movement after eating, is typically strongest and most active in the morning, often within 30 to 60 minutes after consuming breakfast. Make it a non-negotiable habit to sit on the toilet at this specific time every single morning, even if you do not perceive an immediate urge to defecate. To optimize your body's position for elimination, utilize a small footstool to slightly elevate your feet, which places your body in a physiologically advantageous squat-like posture. Allow yourself a relaxed 5 to 10 minutes, consciously avoiding rushing or straining. Over a consistent period, your body will gradually relearn and reestablish this natural rhythm. A vital final warning pertains to the reliance on stimulant laxatives as your primary long-term solution. I fully understand their appeal. They demonstrably work. They are widely accessible, and they provide rapid relief from the immediate discomfort of constipation. However, the long-term, daily use of stimulant laxatives progressively trains your colon to become overly dependent on artificial stimulation to initiate movement. When you eventually cease taking them, the colon has, in essence, largely forgotten how to effectively initiate and coordinate its own movements autonomously. This concerning phenomenon is medically recognized as cathartic colon, and it represents a very real and extensively documented consequence of chronic laxative overuse. Fortunately, there are far safer, more sustainable, and equally effective options available, such as osmotic agents, which draw water into the colon, stool softeners, which make stool easier to pass, and various fiber supplements, all of which your doctor can thoughtfully recommend as integral components of a comprehensive and sustainable long-term plan tailored to your specific needs. I fully acknowledge that today's conversation has been extensive, and I recognize that certain aspects of it may not have been easy to hear or discuss. However, I deeply believe that the most profoundly important health conversations are often precisely those that evoke the most initial discomfort. You unequivocally deserve to fully comprehend what is transpiring inside your own body. You deserve a clear, actionable plan when something goes awry, and crucially, you deserve to know that whatever challenging health situation you may be navigating right now, you absolutely do not have to decipher it alone. And you certainly have no reason to feel embarrassed about it. If you found today's video genuinely useful and enlightening, I would humbly ask you to perform one simple yet powerful act. Share it. Send this video to a family member, a close friend, a neighbor, or anyone in your life who might be quietly suffering with this distressing condition, remaining silent due to embarrassment or lack of knowledge. This video might very well be the exact resource they have been desperately searching for, but did not know how to articulate or ask for. Please click the like button if this information proved helpful to you, and subscribe to this channel so you never miss our upcoming videos focused on vital digestive health topics, strategies for longevity, and empowering you to take authentic control of your health as you gracefully age. Take meticulous care of yourselves. Remember to consistently drink your water, keep your body moving, and I will eagerly see you in the next empowering video.